Welcome to the joint Swiss Re Institute and Asia Society Switzerland event, Heat and Health, the impact of climate change on the Indian subcontinent, the second event in our Climate Change in the Indo-Pacific series. Across India, heat waves are responsible for the death of thousands, and as climate change intensifies, the toll is mounting. Rising temperatures are impacting economic output and livelihoods. Drought followed by floods propagate the spread of diseases. Can India's government and its overburdened healthcare system meet these challenges? My name is Richard Francis, and I'm joined today by two environment and health specialists here at the Swiss Re Next Auditorium. First, let me introduce Mitali Chatterjee, the Swiss Re Institute's own Asian public sector expert based in Bangalore, India. Mitali was previously at Deloitte in their Centre for Government Insights. One of her research areas is public healthcare systems, and she recently published in a Swiss Re Institute report on mental health across Asia in a post-pandemic environment. And Mitali is also our saviour today, as she is stepping in at the last minute for our original guest from India, Dr. Neeraj Mistry, who cannot be with us due to a medical emergency. Welcome, Mitali, to Swiss Re Next in Zurich, well, at least virtually. With us in person this morning is Bernd Wilke, Swiss Re's emerging risk manager, who specialises in environmental risk. He is part of a top-level team looking at sustainability risks for Swiss Re. Another of Bernd's myriad tasks, many tasks, includes working with the prestigious Lancet Medical Journal on their countdown report for health and climate change. Great to have you with us, Bernd. And now I can get on to press my button here, and we've got up today, to explain the format. For those of you who are here with us in the auditorium, you can use the QR code and hashtag on your screen to send in questions for our experts via Slido. You have some time to think up your questions, as we will start off with a 10-minute presentation by Bernd on the just-released Lancet Countdown, which is a particularly important report this year in the lead-up to COP26 in Glasgow. Then we will have a discussion between Mitali and Bernd on the issues raised by Lancet in the context of the Indian subcontinent. We'll save some time at the end of the session to answer your questions. Now let's ask Bernd, Swiss Re's emerging risk manager, to set up the big picture for our discussion today on heat and health, the impact of climate change on the Indian subcontinent. Bernd, please.
Thank you very much and welcome. First of all, I'm not working on the Lancet Countdown. There you went a little bit overboard. I work with the Lancet Countdown on climate change and health. We have certain research projects going on. But that whole affair actually started with this infographic that you see here. And that we published roughly 3 years ago, I think now. At that time, there was a climate change conference in Poland. And that was the first time that actually you saw a report on climate change and health, which before was never a topic because, we looked at floods and all these kind of things. And that's when we also took notice, because we also saw it in our emerging risk network, that actually more and more questions and comments came in, what's going to happen to health. We wrote in that here an article. The infographic you see here is essentially out of this article in the Sonar report. And what you see there, there are a lot of things happening simultaneously. And what you see a little bit in this bluish, it looks from me here, squares on the right side with this blue frame. These are actually the health outcomes that are impacted by climate change in the insurance world. And you see there are respiratory diseases, there are cardiovascular diseases, there are the epidemics, of course, which are potentially changing. But there are also underlying causes actually that will influence that. And that has to do essentially with nutrition, because there are indications that the food supplies will become less, but also that climate change will impact actually how nutritious certain foods will be in the future, because under different climate conditions, they don't have in much nutrients and other things. And When we published that, I was actually then invited to a big conference at the Institute of Tropical Health and Public Health in Basel, because the scientists actually saw that we are working on this topic, and they were interested to hear what does insurance have to do with it. And that's when we met the people from the Lancet, and that now landed in a cooperation with them on certain research projects, not on the Lancet Countdown itself, apart from the fact that the NatCat results, the economic data that you partly find in the report, is actually from Swiss Re. Important from this picture is that you see, I mean, there are a multitude of health outcomes potentially, and a lot of stuff is interlinked. That's very difficult to situations we normally deal with, because we try to deal with different buckets. So let's say, I mean, let's look at this, let's look at this, let's look at this. And here that doesn't work anymore, because a lot of pieces of the puzzle are moving at the same point in time. That makes it very, very difficult actually to predict what's going to happen. I mean, with this background that actually there's a multitude of health outcomes, let's look what's going to happen climate-wise actually in the world and in India. And for this, we first have to go to the latest IPCC report, which came out in August. And you see that heat and humidity will change. And these are the key drivers actually for health outcomes globally, because heat generates stress. So essentially, if you have pre-existing conditions, or even if you are healthy, it will impact actually how well you feel. And also, I mean, how able you are to perform your work, especially when you're outside. And the second fact, the humidity, is essentially determining where certain tropical diseases, or let's say communicable diseases as we call them, will happen actually over time, and the two of them play together. And when you look at this graphic, it's actually a little bit depressing, because I mean, you see the 1.5 degree, the famous one, that's actually currently heralded to be the goal. Personally, I have to say, forget about it. It's not going to happen the way we behave right now. And lately, the latest Lancet report came out, and actually the graphics that you see here will also be reflected actually in the outcomes of the Lancet report. And what they essentially assume when you read it is a 2.4 degree world, which essentially gets us somewhere to the right side of these maps, which is the middle one is the 2 degree, as you see, and the outer one is the 4 degree. And you see essentially some parts of the world become wetter and some parts of the world become warmer. And actually there's and some parts of the world become drier. I should not forget that. What we don't see is actually any part that becomes cooler. And that's the first key takeaway. So we are looking at warming. And it's a global phenomenon. And when we look a little bit at the circle there, which essentially is centering around Singapore, there's one very important thing with this circle. Within this circle are more people living than in the whole rest of the world. And the strongest climate change impacts we expect exactly in that circle. So more population will be affected by climate change in that circle in a more extreme way than in the rest of the world. And the other thing that you have to take along from both the IPCC report in August and the Lancet report is two things. We will get more extreme weather, so more floods, more droughts, more heat, and we will see more extreme extremes. And that means at the end of the day, what we consider today to be outrageous, and we saw that this summer essentially in Germany with the floods, we saw it with the wildfires in the northeastern United States, we saw it with the floods in China, the floods in Turkey, there were events in India. What we nowadays say, oh wow, that's really, really extreme, that's more likely to be the new normal that we see in the upcoming decades. And that, of course, generates big problems on the public health side. And the problems first and foremost, and especially now when we look to the Indian subcontinent, it's not only India, but let's focus a little bit on that one. We have to look at the Himalayas. And what we see is a very weird picture, because actually the world will become wetter, so we will see more precipitation in the Himalayas, but we will see less snow. And that means that the glaciers in the Himalayas will continue to shrink. And that in turn means that actually all the rivers that are feeding the Indian subcontinent, which are extremely important for agriculture and for water in general, also for water for the industries, that these water sources actually most likely are going to decline. That's true for Pakistan, which is very, very important because, I mean, they are very dependent on the irrigation water from the Indus River, but also for the other parts. In addition, because it's raining more, we will see more floods. And we've seen some extreme flooding event. We will see landslides, all these things. And you must think about that any natural catastrophe is normally also a health catastrophe. If you have an earthquake or if you have extreme weather, which means flood, drought, and the like, that normally triggers a public health response. And the question is, are the hospitals, are the public healthcare institutions in these regions are able to work under these conditions? And there's a big question mark around it, and what the IPCC as well as the Lancet and the WHO said, we have to invest more money into the public health care to make it climate resilient going forward. And there a key thing to know is, I mean, we have billions of money to spend on climate change under the Climate Change Fund set up at the COP conference, which is now happening in Glasgow. But of these billions, currently only $40 million are actually earmarked specifically for public health improvements. And that's way below the funding needs that we need. Moving a little bit further, I mean, we have areas in India which are dry, which are normally in the north and northeast. There you see also a lot of wildfires, partly because of agricultural practices, but also, I mean, of course, with these extreme droughts. And these areas are expected to become even drier. And you have to think about that a lot of people actually work in these areas. Agriculture is still a very, very important topic in Asia, especially in India, also in Pakistan and surrounding countries. So these areas actually will face severe drought, and that has impacts on agriculture, and it also has impacts, of course, on the health situation of these people. And then if we move to the weather parts, there we will also see more extreme weather plus sea level rise. We know that Bangladesh is partly way below sea level. A lot of coastal areas in India, also the big cities are close to sea level. And with the sea level rise that we will see, these areas most likely will be underwater. And it will be also more, let's say, what do you call it now? I'm missing the English word. For communicable disease, it will become easier actually to propagate because there will be more flooding, and normally water is very good for insects and mosquitoes who pass that on. And then the last thing I have to tell you is also there's an additional factor playing into how we can respond to public health events, and that factor is called nature. And in the past, we had lots of forests, we had a very intact nature, and that intact nature was a buffer that shielded us from negative public health outcomes. And on this slide here, you see something that we created at Swiss Re, which is called the Biodiversity and Ecosystem Services Index. And what you see on top are risk drivers, and you see climate change is very big in there. And at the bottom, you see the so-called ecosystem services, which are actually important to shield us for negative public health outcomes. And what that means can easily be shown, for example, when we look at forests, because there are two things about forests, especially in the tropical regions. We know that in the tropical rainforest, there are around 850,000 pathogens still hiding, which potentially can jump over to humans, like COVID. And we are deforesting these areas. And deforestation has two effects. The first one is that the interaction between humans and the wildlife will increase, so it makes it more easy that one of these pathogens actually jumps over to the human race. And the other thing is it opens these transport pathways into big cities, which we didn't have 100 years ago. At that time, if somebody encountered a pathogen in the rainforest, the likelihood that he made it out to pass it on to somebody else was close to zero. And nowadays, that's totally different because, I mean, you have these dirt roads, I mean, which you need for deforestation. And on the motorcycle, on the truck with the tree trunk back, The pathogen rides into the next village, from there on a bus to the next city, and from there on an airplane to our places here in the Western world and around the globe, like we've seen that with COVID. And this destruction of the rainforest actually increases that. And then the other point is, what do we need to combat a public health crisis? We need water, and we need clean water. And the key provider of clean water in the world is, at the end of the day, forests. So we are not only destroying the shield that actually protected us from future pandemics, we are also destroying the ways and means actually to deal the outcomes of these pandemics going forward. And when you look at these three things together, excuse me, so we have climate change going on in multiple areas at the same time, with lots of feedback loops. The second thing is we have lots of health outcomes that actually can happen out of this climate change, which will burden the public health system. And we have an environment that's less and less able to shield us against the effects of these kind of things. You see that's a problem for the world, and it will become very pronounced in India, especially because the effects there will also be a little bit more on the extreme end, and you have this huge population density, which is an accelerator for potential negative outcomes. That would be the first little summary of what's going on in the world from my end.
Difficult to summarize a report that big, but at the same time, if you could just go back to the slide with the circle on it, and you know, I found that was I've never heard it put in that way before, that we know where the front line or one of the front lines will be, but it's still going out into a global context in this way. Yet we are not focusing on this as a burning issue at this point in time on a geographic basis. Look, Mitali, you're on the ground there. I mean, you're not quite within that circle, but I think we can safely say the Indian subcontinent is an entity in itself, so it falls into that area. What are your thoughts on Bernd's report there?
Yeah, sure. Thanks, Richard, and thank you, Bernard, for that brilliant presentation and your thoughts on what's happening today and what's going to happen, what's likely to happen in the future. Let me begin with some reflections on what I just heard. So firstly, if you could go back to slide 1 that you presented. Yeah, so I found it really fascinating how the impact of climate change on health is not necessarily a straightforward relationship. In fact, there are network linkages that we often don't piece together if we are looking at health issues in silos. So what the most prominent example here I thought was the sea level rise and how it's linked to reduced agricultural output and productivity, and that in turn links to poverty and migration, and then goes back to rising epidemics. And in the Indian context, I think that's very important given the fact that a large proportion of our population is heavily dependent on the agricultural sector for our lives, our livelihoods, and income. So that's my first thought. The second thought is actually a culmination of what I see in this slide and what I see on slide 3, that when we talk about climate change, probably it's not something that we can speak for in a single breath. We may have to divide this climate change into two parts. One is climate change that is a result of natural variability, and that's not something essentially we can help. But then there is also a large part of climate change which is a result of anthropogenic influences, such as what we see here, drilling and offshore exploration, or even in a broader sense, it could be urbanization or economic growth. And I think it is this human-induced climate change that is something that we need to think about. It's something that we need to mitigate if we want to eventually reach to lower adverse implications for the life and health sector in India or globally. And my third thought would be on the basis of the scenario slide that you presented, Bernard. So if I were to think about this scenario slide in an Indian subcontinent context, First thought is that climate change in India or Indian subcontinent is not a cyclical phenomena. It's actually a structural change driven by some of the factors that you already spoke about, or some of the factors that are prominently mentioned in the Lancet research report, such as rising heat, rising sea levels, extremes in temperature, increasing frequency and severity of some of the natural calamities we are constantly seeing around us, and also erratic rainfall patterns. So, to give you an example, just a few days back, I was doing the small exercise, calculating the standard deviation of rainfall for the last 15 years. And then when I checked back to look at the standard deviation of rainfall for the 15 years before that, so there seems to be a huge jump in the standard deviation numbers, which shows that the erratic nature of rainfall has gone up. And, just like Bernard mentioned, it's extremes and extremes is what we are moving towards. Specifically in India, if we were to look at some of our metropolitan cities like Delhi, Mumbai, Chennai, they are experiencing an increase in the number of extreme hot days. And even the sea levels, there are predictions that the sea levels could rise by a minimum 3.5 inches by the end of the century, which would essentially mean that between 200 to 500 million people living in urban areas will actually be living in at-risk regions by then. So these are some of my initial thoughts, and Richard, Bernard, feel free to share your thoughts on the same.
Thanks very much, Mitali. I think you've also helped frame the conversation for today. I'm going to stick with the Lancet report and the message that it has for COP26 just for a moment, Bernd. We know that the political and corporate engagement is hugely important for COP26 if we want to have anything resembling an interesting result. But this playoff between, in the Lancet report, they talk about the green pandemic recovery versus the return to business as normal for fossil fuels. And this is a little bit, India has a huge corporate lobby for fossil fuels in this area. So what strategies can a developing country with all those entrenched interests and lobbies, what are they going to be able to do to get a green recovery? I mean, also, Mitali, if you want to comment after Bernd.
I mean, in India, it's of course a challenge because what we often forget is, on the one hand, I think there's this corporate sector, with the coal-fired power plants, and that's one thing. The other thing is, how do you cook at home? And the Lancet report essentially focuses also a little bit on that one because it says, we must acknowledge that people will not be able to put food on the table if we don't find a replacement. Now, first of all, I think it needs money, and it needs money also for these public health measures, and most likely it needs more money than we currently have available in essentially commitments by different states. Now, there are two interesting things also in the Lancet report, and I think it hasn't changed yet because, fossil fuel subsidies globally are 500 billion per year. And part of these fossil fuel subsidies go essentially to the poor. That's fair to say, but a lot of these fossil fuel subsidies also go to the corporate sector. And I think if we just would cut these fossil fuel subsidies to the corporate sector and then essentially move this money actually to make it available to improve also the livelihood of poorer people, especially in the rural area in India, for example, that would be one thing. What would we use that money for? There are essentially also ways and means, to get these people fuel essentially in these areas so that they cook in other ways. A lot of them are agricultural, so there are these little biogas things. You could also give them solar panels, which, for example, has worked very well in Bhutan. I once hiked there, and the Bhutanese government once decided that everybody in rural Bhutan, essentially every family, gets a solar panel. Now, you must know, if you've been in that Himalaya country, you walk 3 days to the main road if you're really in the back of Bhutan. And when I was there, actually, there was everywhere a solar panel. And by the way, there was not only a solar panel. In every village, you also had actually a nurse with some basic medication, essentially, to deal with public health issues in these areas because you cannot get the people to a hospital easily. So I think we must acknowledge, that we have to roll out a tremendous amount of resources to the global poor. That's the one thing. The other thing for the corporate sector, there I would say we have to push essentially for a very quick net zero. And I had a Nobel laureate, he was in a meeting of the Geneva Association a short while ago, and he said actually we don't need net zero by 2050, we need net zero by 2030, which is essentially 9 years from today. And that essentially shows you the challenge, but on the other hand, corporates very often have the financial ways and means. They only have to shift a little bit where they put their money. And maybe, yes, it will take off $1 of the dividend that they pay out at the end of the year. But at the end of the day, I think also as a shareholder, I should say that's actually money well spent because it will sustain my dividends for the decades to come. And there I think we are also all asked, because a lot of us own shares, or we are part of pension funds who own shares. And if we say, hey, I can do with $1 less when I go into retirement, that will actually be a big shift. So it's not only the corporates or them, it's also us, I would say.
Mitali, something from your side on this?
Sure. So staying with you on the corporate sector and the role that they can play in mitigating climate change, I think what stands out for me is that in their effort towards moving towards net zero, what's most important today is actually better disclosures. And to give you an example of how it stands as of today, out of the top 100 Indian companies, only 25 or so have, any sort of meaningful disclosures on their carbon emissions. So that's number one, better disclosures. And we are making, a step forward in this direction because recently we have the business responsibility and sustainability reporting requirement norms which have come into place, which is good to have in 2022, but by 2023, it becomes mandatory for the top 100 firms. So I think accountability is the first thing that comes to my mind when it comes to the role of corporate sector, but not just in terms of the operations of the corporate sector. I feel it's not just having sustainability as good to have concept or idea for the corporate sector to implement in their supply chain, but also when it comes to demand, I think the onus is on us, on individuals, on communities to actually cut our carbon footprint and make those conscious, sustainable lifestyle choices in everything that we do, from the food that we eat or the energy consumption or the transportation choices. And that's a bit complex as of now because there is a cost versus efficiency kind of a debate, and for these choices to become mainstream, probably the cost of many of these will have to go down. But yes, I do think it takes two to tango, and it's not just up to the corporate sector alone, but it has to be a multi-stakeholder engagement approach.
Let's, that's the big picture in many ways, leading up to COP26. Let's push it down to the ground level, particularly where you are, Mitali, at the moment. I mean, India, huge population, 1.4 billion. I mean, that's accounting for like 20% of global healthcare. I mean, what's happening on the ground there with climate change? Obviously, India's always been hot, it's always been floods, but what's happening there? What are the implications of climate change that you're seeing even now in India?
Right. So let me try to structure my arguments into two broad buckets here. When I think of impact of climate change on our lives and health, first would be impact of air pollution. And air pollution right now, I feel, is public health enemy number one in India and Indian subcontinent, because we are ranked third among all the countries in the world in terms of the worst air quality. And this is demonstrated by the fact that our nitrogen dioxide levels have more than doubled in the last 40 years. 14 out of 20 of the globally most populated polluted cities are currently in India, and a fourth of the global deaths because of air pollution are from India. And if I were to put a number to that, that would mean probably something like 1.5 million premature deaths every year from air pollution. And the counterfactual to that is that if we did not have such extreme levels of air pollution, if air pollution were under control, then our life expectancy could have been 1.7 years more. But that's just the impact of air pollution on our lives. But it does have serious implications for our health as well, particularly when it comes to respiratory diseases like asthma or chronic obstructive pulmonary disease. More than half the cases of chronic obstructive pulmonary disease in India are actually due to air pollution. So that was my argument number one. Argument number two is related to extreme heat and climatic variability. So, and again, sorry for painting a slightly, morbid picture, but these are the ground realities. So, I must speak about them. So 75% of our districts today are prone to some of these extreme climatic events that, Bernard spoke about, like floods and droughts and heat and cold waves and cyclones. And the probability has actually gone up in the last 50 years. So probability of flooding is 8 times more, probability of drought is 13 times more. And if you just look at the number of lives lost, last year, it's more than 2,500 Indians who lost their lives in some of these natural calamities. And actually, it's not just last year. If you were to look at just last week or last month, it's been all over the news, the kind of human tragedy that has taken place because of the flash floods in northern India and Nepal, or the cloudbursts in West Bengal and Bangladesh, or the extreme rainfall in Uttarakhand, which was almost like 500% more than what it receives on an average normally. Then in the south, there were floods and landslides in Kerala. So there is a lot of loss of human lives and damage to property because of these human-induced climatic events recently. And the predictions are even more morbid because it is said that maybe because of this extreme heat, about 1.2 million people in India would lose their lives every year by 2030 or 2050. And again, coming back to the impact on health, so probably extreme heat increases the probability of diseases such as cardiovascular diseases and respiratory diseases, particularly among the elderly. It also increases the spread of vector-borne diseases, waterborne diseases like we have malaria, dengue, chikungunya, and it has a larger implication under tropical settings, under non-tropical settings. So that's also something that needs to be taken into account. Also, I think it's not just the explicit physical health, but also the fact that the agricultural sector is stressed because of climatic variability and extreme heat, and yields of our staple crops such as wheat and rice could go down drastically, because of which our problems of malnutrition, undernourishment, these could get exacerbated in the near future. And also there is loss of human productivity. So labor hours lost could amount to as much as 2.5 to 4.5% of the GDP by 2030. And this is all something that can be documented, but what I majorly feel for, and something that's generally not really documented, is the impact or the toll some of these natural calamities take on our mental health. These episodes of floods and earthquakes and landslides, they actually represent a shock, and this shock can result in rising incidences of post-traumatic stress disorder and even anxiety and depression, because all around you're seeing people lose their lives, and there's damage to property, and there are illnesses. And while the impact on physical health or impact on lives lost or damage to property is something that's well documented or can be well documented. Impact on mental health is something that we don't read about much, or we don't find it documented much. And also, given the cultural or the socio-cultural settings we have in India, it might even be sort of a taboo subject, and hence often ignored. So I think it is, the climate change gets manifested in India through some of these channels.
Mitali, picking up on that point as well, I mean, that's almost moving into a modern issue, but thinking about how traditional India is, and also the diversity within the population. I mean, it's climate change will be influencing. We heard it from Bernd as well, the rural-urban divide. I mean, with the COVID pandemic, we've been hearing terrible things about how unequal the impact has been. Could you perhaps elaborate a bit on that? What could happen?
Yeah. Sure, Richard. So I think there are two issues here that we need to think about. Firstly is the innate inequity and inequality within the society that could impact certain parts of the population more than the others. So I would say women are more disproportionately impacted because of these climate change related issues. Because inherently, we also have a problem of gender inequality within the Indian subcontinent. And this problem gets exacerbated and results in double burden of some of the health issues, such as malnutrition or worsening maternal and neonatal nutritional outcomes, or even adverse reproductive outcomes such as preterm delivery and food insecurity. So it results in increasing mortality and morbidity for women, I would say. Also, given the fact that they typically have accessibility issues to their nearest primary healthcare centers, particularly in the context of some of these natural disasters when they strike. And also, you have to look at the socio-cultural settings within India, because of which women sometimes are subjected to more, I would say, heavy or restrictive clothing, particularly in the rural areas, and that's something that can make them even more vulnerable to heat. And the second response to your question would be more centered towards how the public health infrastructure in India is, and whether it is sufficiently equipped to handle additional demand due to natural disasters, particularly in the era of COVID-19. And my short answer is no, not really, because right now our public health expenditure as a proportion of GDP is really low. It's been stagnant at about 1% for quite some time now, and this probably translates into outcomes such as low bed availability, low ICU availability, low ventilators, shortage of equipments, and even less physician. I mean, about 7 to 8 physicians per 10,000 of the population, or about 0.5 to 0.6 hospital beds per 1,000 of the population. So given this inadequate primary healthcare structure, rural health infrastructure, and overall health infrastructure, you throw in something like a COVID-19 pandemic, and we've already seen how the health infrastructure was almost on the brink of collapse at the peak of second wave. And you factor in something additionally that happens, for example, a flood or a landslide of massive scale that further kind of results in increased spread of some of these infectious diseases that require hospitalization or treatment. And you know that the health infrastructure in its current state will not be able to cope up with this increased demand. So something is lacking and something needs to be done.
Thank you, Mitali. I'm going to give you a little break and go back to Bernd here because you've been doing a lot of the heavy lifting there. But sticking a little bit with this inequity issue, I mean, the Lancet countdown says that an inequitable response fails everyone, and it's also concluding that climate change is not just going to affect us in the future, but it's already starting to reverse progress that we've made with global development and human development over this time. I've got a question come in from the audience which sort of syncs quite interestingly with this. How does the reinsurance industry influence the change towards better measures to improve resilience and adaptive capacity in a country like India? So we'll come back again to some more on the ground stuff, but in that big general picture, let's just set it up a little bit for what insurance can do, or are we part of the problem?
Currently, I think, we are starting to think about it. There's a lot of things, also in what Mitali said. I think that there are two key things. And the first thing that Mitali said, I think, which is clear, is it's a structural change, which means, we are going into a different world. And if we keep the infrastructure that we have, essentially, be it public health, be it protection against natural catastrophes and the like, on the level that we are now, then we will see big human suffering. And I think the last COVID pandemic was the example in case, because, the Lancet also pointed that out. You can also read that in the economic sections of your newspapers. A large part of the world has become poorer. And the effect is normally that especially the poor, and we also will see that in India and other parts of the world, a lot of the people are roughly a tiny tad above poverty level. And so, if the wealth overall just dips a little bit, then suddenly a huge part of the population dips below the poverty level, which essentially robs them of the ways and means also to take care of their health. That's very basic. It starts with the food. You don't have enough to eat anymore. The second important aspect that she said is, we have to deal with a different situation, but of course we have to ask ourselves, we don't want to end up in an endless adaptation cycle. Because, if we don't stop global warming, it will simply mean it gets warmer and warmer and warmer and warmer. And that means the weather patterns will change and change and change and change. And it never stops. We don't go in the direction of a new steady state where we say, hey, this infrastructure that we have now, or these procedures that we have now, to deal with this new environment actually is going to deal with it going forward. And if we continuously have to adapt, then of course we have to shift money in this continuous adaptation. And that money, of course, is missing actually to deal with issues like poverty around the globe, because you have to spend the money somewhere else. Now, the reinsurance industry, I think, is moving in the direction in the right, not the whole part of it. There are still insurance companies who stand, I would say, a little bit on the sideline. It's not necessarily that they progressively do something, but we have now insurance companies, Swiss Re is part of them, who say, hey, we have to go to net zero. It's a key priority. Because otherwise, we will run into global problems, which even for the insurance industry as a whole will be difficult to deal with. The part where I think where we are taking the first baby steps right now is really in the public health area. And there the point is, because I said, I wrote this article about climate change and health in the Sonar report, I think 3 years ago. And then also from the client side, we got a lot of feedback. Actually, we now have a course on sustainability at Swiss Re, which is oversubscribed by insurance professionals, where one aspect is actually climate change and life and health. Now, what you must see is, on the physical climate change risk, which is like floods and extreme weather, hail, drought, etc. Also on the general side, we have 4 decades of research that we rely on. We have models, we have everything. In the public health sector, we have started essentially 3 years ago. And currently we have 2 research projects going on with the Lancet, one actually on air pollution, the other one on dengue fever, where we try to develop these first mechanics to actually predict what will a dengue fever wave look like under the climate change scenario X in 2050. And as long as we don't have that baseline, essentially, then it's very difficult for us, essentially, to develop insurance products for that. The other point that we must consider is, okay, once we have this baseline, then now what? And our head of life and health here in Swiss Re, because that's normally what I can talk about best, he 2-3 years ago, he said also, I mean, we have to do something about sustainability, because so far it was this flooding, hurricane kind of topic, but he said this coming. And I think he did something very smart, because he said, I asked my people, I mean, what would be ideas? And what became very quickly clear is essentially currently the life and health insurance industry, of which Swiss Re is part of, is carrying to the rich of this globe. It's people in the United States, in Europe, in Japan, nowadays a lot also in emerging markets. But even in these markets, it's fair to say it's currently concentrating on those who have money. And what we discovered is, and that goes back to the other thing that Mitali said, is essentially, if the insurance industry wants to have a positive impact, we must now consider, I mean, how do we bring insurance on an affordable level to those who are currently not insured? And there is, of course, an overall benefit, and we saw that with COVID, because when we looked, for example, at the United States, and I guess most likely in India it has been the same, there have been wealthy people who stayed in the home office, got their COVID vaccine and were safe, and there were the poor people who didn't have health insurance, who had to go to work even if they had COVID, because otherwise they couldn't pay their rent. And that was in the United States of America. But of course, I mean, we are sitting in the home office, we cannot isolate ourselves completely from those people who not having health insurance, which means over time it still spreads even in our home office and we go as sick as the other ones. And I think we must understand that, because, I mean, just me having health insurance doesn't do the trick. All of us need health insurance, which means all of us need to have this access. And there's some heavy lifting to be done also in our industry, where we have to say, hey, what can we bring to the table? And we just discussed it these days also with the Lancet, because on the one hand we said, okay, it's fantastic when we have this baseline, what the dengue fever wave looks like in 2030, but essentially what do we do then? And then a colleague of mine said, well, maybe we need a second model, which essentially would be a little bit like what we have in drought insurance nowadays, because we know in general we will know there will be more dengue fever in 2030 in country X. That's fine. But I mean, to actually say what will it look like in the next year, that I don't know, because currently it's only a trend over decades. And so we need a second model, like we have it, for example, in agricultural insurance, which essentially gives us a little bit the forecast for the next year, like we have it with El Nino and La Nina, where we know these weather events, what kind of impact do they have on drought and rain in agricultural reasons. And if we could say then, well, actually next year looks to be very good dengue year, then we could define an insurance policy which allows governments actually to get access to cash, because governments normally need cash fast to react. And that in turn would mean that, for example, they could distribute mosquito nets or something to do something that weather condition which is favorable to a dengue epidemic essentially is counterbalanced by actually measures from the government, so that we will still have these weather conditions because we cannot change that, but we have a response which actually keeps the infections numbers down. And I think this kind of thinking we will need more and more going forward. Another example, just to close with that one, out of this project that the Lab of Life and Health also generated, says, okay, then what can we do? What would be a first good example to bring health insurance to currently those who don't have? What they discovered in certain countries in Africa, not even the nurses and the doctors in the healthcare station in the rural areas have health insurance. And then they asked themselves and said, well, actually, that's a cool idea. Why don't we insure this population? Because A, we have access to them because we know where they work. And on the other hand, if we give them health insurance, it has positive impacts on public health as it is. because they don't get sick in times of crisis, and they can deal with the people because we can treat them in time. And this type of creative thinking has to become, I would say, business as usual in the insurance industry going forward. And there, I think we are very much still at the beginning of our journey right now.
Mitali, I'm just going to ask you to bring that down quickly to the local level in India. What solutions are there for the country to mitigate the impact of climate change on health, and insurance's role? Where you're seeing some examples there?
Sure. So, as I had mentioned before, inaction is not an option, but at the same time, a single agent cannot really propagate change. So it has to be a multi-stakeholder engagement approach, and starting with what we just spoke about, the insurance sector and how it can help act as an enabler. So the obvious ways in which the insurance sector can impact, I think it's already been covered, that we need to kind of ramp up trying to reduce the protection gap, reduce the out-of-pocket expenditure for the majority of Indians. And to give you some context on how big this problem currently is in India, so more than 60 million people every year actually plunge into poverty just because they're paying their medical bills. So that's the extent of the problem, and that's something that the solution to which can be really, creatively designed by insurance and reinsurance sector. And not just life and health insurance, I think other lines of business can also play an important role. You have agriculture, motor, property and engineering. All these sectors indirectly can make a difference by really trying to make the economy more resilient by making sustainability a core focus point, and that in turn is going to generate positive externalities for health and our lives as well. So that's number one, insurance. Number two would be, of course, public policy, and because I think it's the key influencer in this space, just in terms of increasing the public health expenditure as a proportion of GDP from the current 1% to maybe a 2.5%, I think can have a huge impact, which will trickle down towards all other health infrastructure related dimensions. So, for example, you can have more physicians or more hospital bed availability, more ventilators, more equipment, better rural health infrastructure, better primary care health infrastructure. But it's not just about the availability of beds and hospitals. It's also about ramping up specific specialities in the Indian subcontinent context, like I would say internal medicine, family medicine, pediatrics, geriatrics, and psychiatry, because I think it is these specialities which are going to play an important role in the aftermath of some of these extreme climatic episodes, in trying to stabilize the economy, or trying to treat the people who are most impacted. And the third, I would say, is not just concentrate on ramping up new health infrastructure, but also make the existing health infrastructure more resilient, more weatherproof, so that in the aftermath of some of these natural disasters, they themselves should not collapse, and then people will really have nowhere to go to. And lastly, I would say that I think women themselves can play an important role in bringing about social change. They can help in influencing policy interventions and making sure that these policy interventions are probably more targeted towards their needs and preferences, given that they are more adversely impacted than the others.
Look, I'm just going to stick with you there. We had a question come in, and my apologies to the live audience, but it's a good question that came in about an effective public policy response, and also a little bit that was on the what the role of reinsurance is. But in none of this, just building on that question from the audience, I'm not hearing private health sector in these words. We're sort of turning to the public here. What is private health sector with insurance? This is a connection that goes very deep. What's going on in India?
I think there is a lot of inequity between public healthcare and private healthcare in India, and one has to distinguish between what the people want and what the people can afford. So I think there are a lot of research. There's a lot of research which talks about how maybe more than 70% of Indians probably trust private healthcare more than public healthcare, and they would probably go to private healthcare if they could afford it. But the reality is that most people, and here I'm really talking about rural areas, remote areas in the country, they don't have, either they don't have access to private healthcare, or they don't, they can't afford private healthcare, which is why probably private healthcare is a topic of discussion that is limited only for the privileged in India, while you will find a lot more literature and a lot more discussion happening around something like maybe an Ayushman Bharat, where the eligibility or people who can come into the fold of such a scheme is far more. You can have more than 50% of the population theoretically within the fold of Ayushman Bharat. So I think that's the reason why private healthcare is really relegated to the background and never in the mainframe. So if private healthcare was to become a part of the mainstream discussion here, I think affordability is one thing that it needs to focus on, because most of it is for profit, and that's not something majority of Indians can afford.
Look, my apologies to the audience. Because it was such an interesting discussion, I probably won't have time to take questions here, and we've been taking questions off Slido. But now I think we should try and wrap it up here from our experts. First, Bernd, your top 2 or 3 takeaways for the audience around the topic.
I think that the first takeaway is easy. I mean, in COP26, hopefully, we should go for net zero by 2030. That's my personal opinion. 2050 is way too late. That's number one. The number 2 is actually, there's also the COP15 virtually going on, which is actually the COP on biodiversity and ecosystem services. And there we also need something very punchy. The goal is, I think, to get 1/3 of the world actually under natural protection. That means marine ecosystems and also terrestrial ecosystems. I think these 2, that will be the key things actually to stop the negative developments, to get to the root cause, so that we get back to this new equilibrium to which we then can adapt. And the third part is essentially what goes to Mitali. Essentially, we would need in every country in the world public health care which is affordable. And I think public health care can never be profitable, because it just has to balance off that the premiums are enough essentially to pay the services. There we have to think carefully what these services are. I think a lot of it has to be in the area of prevention, like vaccinations and other things which actually avoid that people get sick in the first place. And when you ask me what's the role of the insurance industry there, of course, we will struggle to offer a product there, because we are private companies, so we have shareholders. But what we could also offer is simply our knowledge how to balance off an insurance portfolio. And at least the governments who decide to go for public health care then don't have to reinvent the wheel on their own. And maybe the insurance industry can offer that as a not-for-profit service, simply to get the public health care done, which I think would also be in interest of the private companies, because if the general public is insured, we will see less extreme health crises, which then would spill over in this private sector, like in India, where we then also see losses. So it's also a little bit in our self-interest to say, let's also boost public health care.
Mitali, your key insight or wish for your country?
Right. So let me start with the undeniable, the fact that yes, we can't really ignore the fact that climate change does have a major impact on the socioeconomic determinants of health, like access to clean air and drinking water and food and sufficient food and shelter. And in the Indian context, given that we now know that the main stressors are probably air pollution or extreme heat or rising frequency and severity of some of these natural calamities, and the manifestations is more in terms of impact or probability of rising probability of things like cardiovascular and respiratory diseases, or loss of productivity, or loss of lives, or the rising burden of mental health issues as well. So given that we are within this context, so I think what is the top two things that we need to concentrate on, number one is to reduce the inequities, and that's something, again, Lancet research has covered extensively, that we do have rising inequities in the context of climate change, be that between between the different genders, or between the rural and urban divide, or the public and private health sector divide. So that's one. We need to reduce these inequities. And secondly, I think, again, I think merging towards what COP26 is focusing on, it's not just about identifying what the stressors are, but also coming together to kind of find out possible solutions for those stressors. So you need to have better public health. We need to have better public health infrastructure. We need to have more resilient public health infrastructure. Private sector needs to ramp up its efforts, be it in terms of better disclosure, lesser carbon emissions, and the likes of that. And finally, of course, the insurance sector, which can really help in reducing out-of-pocket expenditure in a country like India, where so many fall into the trap of poverty just because they're paying for their medical bills. So I would say, yeah, these two are probably my wish factors for India.
Well, there we have it. It's a real challenge, obviously, out there. Thank you very much to Mitali Chatterjee, the Swiss Re Institute's India-based specialist on health and climate change, and Bernd Wilke, Swiss Re's emerging risk manager here in Zurich.